thank you. Thank you for this invitation. I have the pleasure today to be with you to present the situation in Tunisia during the first wave of COVID-19. Are you are you seeing my screen here?
We can see your screen.
Okay. So let's present first of all the context. According to
Maybe you
Reporters
can make
Without
it a
Borders,
presentation. Maybe you can enlarge it.
I prefer like this because I have a text.
Okay. Just go ahead then.
Thank you. So, according to Reporters Without Borders, is global press freedom barometer for 2021, Tunisia was ranked 73, dropping 1 point this year. But this result did not surprise press freedom advocates, as several confrontations between journalists, the government, and the parliament have taken place during this past year. It's due to the nomination done by the government to head the Tunisian press agency, Tunis Afrique Presse, and the radio station, private one in the past, and being a public one after the revolutions, Shams FM. These nominations are already sufficient to confirm that freedom of expression is threatened. In another wise, many media actors in Tunisia are questioning the funding sources for Tunisian private media. Moreover, the financial situation of journalism in Tunisia has been complicated over these 10 last years, despite the regulations of media practices by the Tunisian government, like the Haida, which is the TV and Radio Regulation Institution, and the Press Council. There still exists an ambiguity concerning the sources of funding for private media in the absence of media transparency, and this lack of transparency has automatically, of course, affected and needed the freedom of expression as businessmen invested in media sector to manipulate the public opinion through the media, as you know. Then, which is the point very important, access to information. Access to information is the major issue that Tunisian media suffered from, especially with the coronavirus crisis. So this is the beginning of this crisis. ASF, Reporter Without Borders, confirmed that the Tunisian journalist has been faced with a blockage to access to information and sources under the pretext of the health crisis. And yet, given their crucial role in informing the citizens, journalists try to find other ways to provide information to citizens around COVID-19, especially as Tunisians regained confidence during this period in traditional media. Then in Tunisia, like in the majority of countries in the world, media appetite is regaining some semblance of strength thanks to the health crisis, of course. So media credibility has recovered during this first wave of COVID-19. This is indeed the case in France, of course. On the other hand, the first wave of coronavirus, which imposed a general containment all over the world, including Tunisia, that has put in place some new journalistic practices. So the media sector has also been affected by these new practices, while some journalists continued exerting their work in real time. Others moved to online and remote work. But the financial condition of Tunisian journalists are sharply different from the condition of the European counterpart. Note also that according to the report about the material situation of journalists and the independence of information 2017, 15 of the Tunisian journalists interviewed receive a salary less than 115 dollar per month, and 21% of them received a salary between 115 and $300. According to the same sample of this report, just 12% of these journalists receive between $215 and $400 dinar, and almost of them, and almost, that's meaning 15, only obtain a salary of more than $400. In addition, this report confirmed that the half of the interviews work without contracts, while 19 have job contracts. Only 12% of these interviews are in a permanent position, and 19% are recruited according to other formula. So this context led us to examine how Tunisian journalists have assumed their role in this exceptional period. We wanted to investigate whether Tunisian journalists have the resources to cover COVID-19 news, taking into account their financial situation and the current critical situation of media. The research methodology and the corpus, briefly. During the first wave of the coronavirus, we launched a questionnaire among Tunisian journalists to find out how journalists are covering the coronavirus crisis between 13th of November 2020 and 15th of May 2020, the period of the first general confinement in Tunisia. So we have thus received more than 315 responses, of which like more than the half of these responses aged between 25 and 34 years. Likewise, 35.7% of respondents work in digital media, 33 or 34% work in radio station, and 20% work in TV channels, and 10% work in a print newspaper. Added to this was 61.8% of respondents are polyvalent journalists, while 20% are culture journalists or working in another field. So the idea to study the role of Tunisian journalists during this exceptional period promotes us to focus on two axes. On one hand, the journalist content produced by Tunisian media companies during the COVID-19 crisis, and on the other hand, the economic situation of Tunisian media companies since the COVID-19 crisis. So let's start with journalist content provided by Tunisian media during COVID-19 crisis. According to this questionnaire, 27.5% of respondents confirmed that they continued to exercise their profession following the emergence of the coronavirus, while 12.5% of journalists were obliged to forced leave. The reason why some journalists did not work, the financial inability of media companies to pay their salaries, the freelancer status, and newspaper is printing stoppage. Indeed, the journalists of the digital media continued to work despite the crisis, which really affected the print press, although print journals are already suffering from a crisis. Many Tunisian newspapers have chosen to stop their publication during the first wave of the coronavirus. We note also that no one of the respondents has mentioned his inability to manipulate technology. Many professional training courses have been provided to Tunisian journalists since the revolution in order to develop their IT skills. Added to this, no journalist mentioned that he was afraid of the sanitary conditions. Regarding the journalists who confirmed that they continued to exercise their profession with the launch of the coronavirus, more than 37% has have been in remote work, while 31% worked in the field and 31.1% did both, depending, of course, on the conditions and context. About the work conditions in the field, most of them wore the surgical mask and occasionally washed their hands with the hydraulic gel. However, 78% respected social distance and 2% disinfect their equipment or worked remotely. And during the crisis, and in order to implement social sanitary measures aimed to combating COVID-19, great pressures was put on the information media to act as relays for the governments and to promote its measures within of the public. Regarding the journalistic work provided, 46.4% limited themselves to writing short stories and 41.1% provided online or via phone call. In real time, like 20% covered press briefing from the Ministry of Public Health in Tunisia and 25% conducted direct interview. Only 1.8% of journalists wrote long-form reports or opinion pieces or covered the situation in hospitals. Indeed, journalists play the role in this context. The first role, inform the public about the situation. The second one, providing information to decode and understand the situation. And the last one, analyze the consequence. To carry out their work, journalists turned to several sources of information. 83.9% used phone calls, while 53.6% used the internet. More than 15 relied on information from press conference, and the same percent communicated directly with the news sources, and 44.6% used Facebook as a source of information. Moreover, many doctors and politicians get involved on Facebook to communicate around the health crisis. In addition, many Facebook groups dedicated to this crisis has been launched to share data on the virus and how to protect oneself. So 78.6% of journalists use technological tools and devices to ensure their work, namely internet connection, computers, mobile phone, Facebook, WhatsApp, Zoom, Skype, KineMaster, and others. Some journalists have used application or websites to verify the information. Then 62.5% of journalists confirmed that their media didn't change their content and didn't take into consideration the new context. In the meantime, 32.1% of journalists have attended online training, knowing that DW Academy, the German academy, has launched a Facebook group named We and the Coronavirus. Um, in the same time, International Journalists Network also offered dozens of free online training courses for Arab journalists. There were also some individual initiatives. These trainings are focused on covering the crisis, checking information, combating hate speech, the rights of refugees during the corona context, video editing, the safety of journalists, computer securities, and others. What about the economic situation of Tunisian media since the COVID-19 crisis? So, the COVID-19 crisis has economically impacted media companies to the point that the media in many countries went through a serious financial crisis. When the COVID-19 pandemic struck, due to the high risks of contagion and the absence of a vaccine during the first wave of this health crisis, many industries were forced to slow down or even uh, stopped their activities, which caused a major economic crisis. The World Bank announced in June 2020, if you remember, that the COVID-19 pandemic has had a rapid and massive economic impact that has never affected so many countries in the last 115 years, despite massive government aid. About the economic situation of Tunisian media, it was 69.1% of journalists have confirmed that their media companies have been affected by the COVID-19 crisis, which is why 20 or 12.5% of journalists were forced to quit or fired. The other ones continues to exercise their profession even in severe conditions. Indeed, Tunisian media companies suffered from the decline of the advertising revenues. I think it's the same situation in many countries. So there was often a delay in the payment of journalists' monthly salaries. Some journalists received half of their regular salary, and some media companies worked with the half of the journalistic team. Some Tunisian media companies have also cancelled their performance bonus, the 8-day bonus, for example, and some other perks like meal vouchers and others. Although some newspapers have chosen to stop publishing their print version, the other ones have minimized the publication opportunity in order to reduce costs. To attract more audience, some media try to review their journalistic practices and find out how to play their role in these times of pandemic. For example, by creating an online visual content dealing with health issues, or by producing a TV and radio programs covering new related to the COVID-19 crisis. Even though the public expresses an interest in knowing all the details related to the pandemic, few Tunisian media have been able to benefit financially from the increase in audience observed during this period, and it's uncertain whether this increases This is increase will continue after the crisis. To conclude, we confirm that journalists fulfilled a vital mission during a crucial time. Despite limited resources, Tunisian journalists have made an effort to preserve their jobs during one of the most demanding periods on their careers. But this difficult period was a sign that demonstrated the passion these journalists felt for their profession. In another hand, this situation in the Tunisian media and this decline in the right to information occurring with the pandemic made us not truly satisfied with the role played by journalists in this period of global health crisis. For a long time, the Tunisian media scene has raised the alarm in order to find solutions to save print newspapers, and some audiovisual media and of course after or offer a profitable and sustainable business model. Then the COVID-19 crisis confirmed that the advertising revenue should no longer be an essential element for a media sustainability, but we have to look for another solutions. Protecting the access to information as an essential element of any democracy society. UNESCO also feared that the economic impact of COVID-19 poses an existential threat to journalism, but believed that this moment also offers an opportunity to recognize journalism as an essential part of our lives and resources, and to restrain the news media today and in the year to come. Thank you for your attention.
Thank you very much, Dr. Nouha. I hope you can all please do feel free to post any questions you might have. Glad to see that the Tunisian journalism became quite innovative in this time period, and we will engage more on that. So we'll go directly to the next presenter, and that is Noha Atef. And Noha Atef comes to us from the School of Communication Lab at Simon Fraser University. Her professional background is in press, broadcast journalism, and online media. She obtained her PhD in media from Birmingham City University in 2017. And she's also worked for the Birmingham Center for Media and Cultural Research. So she's taught in a number of universities in Egypt, and we're looking forward to hearing what she has for us today. So Dr. Nouha, please go ahead. Thank you.
Thank you, Dorothy, and thanks everybody. I'm glad to be with you. It's 3 a.m. now in Vancouver, Canada. So I'm starting the day with you today. After all the consequences of COVID stated and explained by Noha, so me and other Noha looking to COVID as a half full glass and trying to demonstrate some good implications of the pandemic on journalism. And I think, there are a number of positive things that we can state when we talk about this, about the pandemic. Mainly the good results or gains for the journalism, for citizen journalism, and for the media environment in general. So what I'm trying to answer through this presentation is, have the pandemic get any good to journalism? And the answer comes from a role I had in May 2020. So in the middle of the pandemic, I was commissioned by ARIJ, the Arab Reporters Investigative Journalism, which is a flag media organization in the Arab region. I was commissioned to write this recommendation paper about combating disinformation and misinformation in the Arab world. And doing this, there were 17 interviews conducted with journalists, news editors, fact checkers, citizen journalists, in addition to 3 focus group with the same, not the same people, but like we had communication with these groups through interviews and through focus groups. We also conducted a survey, especially to Arab journalists, both males and females, and we had over 200 respondents. The survey asked them questions about their everyday work routine and their self-assessment to their performance during the pandemic. And also we had digital ethnography. So we were like on, there is a group run by Arij, a Facebook group called Arij Maakum, Arij with you. And we would go there, observe and ask questions, and make polls, raise conversations, stir conversation under the hashtag Arij Asks. So we were communicating with journalists, citizen journalists, media experts, and media trainers. And through all that, we can find out that the first, and in my assessment, the biggest gain of the pandemic is that it eliminated a number of challenges in the work of journalists. One of them is the lack of qualification in medical journalists. Corona and all the COVID news are purely medical and scientific, and we don't have the qualified cadres or the journalists, the qualified journalists to report on them. And this lack of qualified journalists has led to misinformation. So the journalists would do their best to write, sometimes they would do their best really to write a good piece, but they don't understand the information, or they would just translate published material in the mainstream media, in the foreign mainstream media, without being able to double check it. Also, the information inaccessibility, and this like was noted by Nouha in her previous presentation. So in 2 levels. First level, the information as research, the journalists in most cases, or in the Arab region or North Africa in general, they don't have access to the medical research and the scientific research. The journals will not make this publicly available for them in most cases. Plus, their lack of qualification may let them misinterpret the information. And in addition to that, the governments and official bodies will not be very cooperative with journalists and let them, will not share all information with them. And in some cases, it was the same with the big, the leading organization, the representatives of this leading organization also would not be responsive enough to journalists. Plus the personal safety. This was a challenge too, because journalists didn't know, like anybody, they weren't in many cases may not be able to take all the precautions to protect themselves from the virus, especially that by time the prices of face masks went high, for example. It was a bit unusual for them to disinfect their equipment, something like this. So COVID has eliminated these challenges. The second gain is that the pandemic has raised some ethical issues regarding the journalistic practices. One of them is the appearance of COVID-infected patients. It is ethically acceptable that we have these patients on TV, like we show their identity or even have their name written? Should we interact with them at first place? Like as journalists, should we speak about them humanly? Should we identify them? Plus, there were a discriminatory discourse against some age groups. In most media outlets, it was stressed that aged people or people who with chronic disease, people who are senior citizens, they are more prone to get the virus. So can we say that this is a bit discriminatory? And the relationship of journalists with the audiences, I think this is very alerting, because we can observe like a sharp language used by journalists, especially broadcast journalists, towards their audience. So they would patronize to their audience and criticizing harshly those who do not observe the self-isolation or the precaution measures or whatever. And even in Egypt, in my country, it happened that one of the talk show presenters, a famous talk show presenter, Tamer Amin, he had to apologize in public, on air. He had to apologize for his audience for the language he used to criticize people who do not stick to the procedures. We can also see in that, the audience who were criticized in most cases are from the struggling classes. So a number of unethical issues in the relationship between journalists and their audience. Either they are the patient, the people who might become patient. Using the word suspect, if we say like someone is suspected to have COVID, is it acceptable to use this term in first place? So the pandemic brought these ethical issues to the fore, and we have to consider them now. Yes, the problematic terminology used in reporting pandemic news. The third gain was that COVID urged the journalists to upgrade their digital skills, and this is a big gain in my assessment, because during the lockdown, we find journalists learning more about digital media. So I think a lot of journalists has attended at least one online training during the pandemic, and this is very good, especially in conflict area. I mean, in North Africa, there are several armed conflicts going on, and this restricts the mobility of journalists. So even moving from a city to another, if a journalist is living in some city and there is a training in their own country, but in the capital, let's say, or in a different city, it would be hard for them to attend this. But with upgrading their digital skills, they can receive this training online. They were urged, or they had to upgrade these digital skills, because also most of them had to communicate with their editors remotely. Moreover, the pandemic alerted journalists and their audiences from fake news. I think fake news was very used. The term itself was very discussed during the pandemic. Fake news, misinformation, disinformation. This wasn't the case before, at least in North Africa and their region. So by the pandemic, people, even if fake news continues, but it's again that people are now alerted that not everything being said, even in the mainstream media, is true, and they need to doubly check it. So fake news was a big, being alerted to fake news was a big gain. And for journalists, I can see a lot of journalists, and as we got from the survey, there are many journalists who started to use digital tools to verify their content. So to verify the photos, to verify the news, the trainings about the news verification was there were numerous trainings about how to verify news during the pandemic, and this is also a big gain, Plus, COVID refreshed citizen journalism, and what I mean by that is that more citizen journalism initiatives have been launched during the pandemic. most of them focused on news verification and covering or connecting like people who would like to volunteer to help the patients, the COVID patients. So one of the people who worked on on the recommendation paper with me, she is a journalist, and she's also started like through Facebook. She launched an initiative to cook for people who are in self-isolation and have nobody to cook for them. And she coordinated that, had this initiative, and was like delivering they were voluntary work, like, but she launched this during the pandemic, and without the pandemic, this kind of citizen journalism or citizen activism or whatever wouldn't have been exist. In addition to a big number of Facebook groups actually verifying the news regarding the pandemic and other news, they're still running so far, and like looking to the trending topics, the trending content, media content, and verifying it. So this is again a big implication of COVID on journalism. The last thing which I'm curious to know from the audience is what positive impact did COVID have on you as a journalist or as someone interested in media in general? And I'm glad to receive your questions as well. Thank you all.
Well, thank you so much, Dr. Atef. That was really interesting. It mirrors a lot similar research I did here in Kenya, here in East Africa, issues of technology, issues of lack of sufficient scientific knowledge to communicate about COVID. So I hope that's something we can talk about and compare notes. So so again, encourage you to continue posting your questions. We really want to have a discussion after this. So feel free to post your questions. I want to recognize the presence of Professor Audrey Gazipo. Karibu sana, welcome to this session. We're happy to have you from University of Ghana. Okay, so next we are going to, I'll switch things around a bit, and we're going to be listening to Gladness. Gladness, are you here with us? Okay. We seem to have lost her, so we'll listen to her when she gets back. So right now, let us go to Lilian, and I will just introduce her briefly so that she can speak to us. Lilian Mukoche is a radio producer and presenter, and the station supervisor at 103.9 Must FM, which is a university radio in Western Kenya. She also writes for Talk Africa and the World Pass, and is a contributing volunteer, a volunteer contributor on environment, economic empowerment, health, and gender-based violence. She has worked with Peace-Pen Communication and has participated, in climate change media clinics. So she has also participated in AVIM before, and we're talking about debunking fake news. And she writes and broadcasts mostly on COVID-related stories. So she has a short presentation for us, and we're going to listen to her now. Lilian?
Yes, I'm here.
Okay, so yes, I'm looking. So karibu sana, that is your presentation.
Okay, thank you. Allow me to do without my back. I'm having a bad background wherever I am. So if I can do minus my camera on, is that okay?
Yes, we allow you. Go ahead.
Okay, thank you. Okay, my presentation is very brief about how we have the first Daktari.
There's other times when my mouth can't just stop
Kindly.
eating.
Oh, you want to go
When I
back
feel
to the
like I'm
first
succeeding,
slide?
but I still want to just.
Kindly the first.
Still want you to just.
Okay, my presentation is about some of.
I'm sorry, I don't know what's happening with this computer. I think you may have used animation or something. I don't know. It's just turning by itself. I don't know what happened because it's just moving by itself. Sorry. Let me share fresh. Okay, there you go. I'll not make it a show.
Okay, thank you. My presentation is very short. It's not. I just did the summary. It was about the role of the media, the role of community radio stations in COVID-19 prevention and management in Kakamega County in Kenya. I was so specific. I went by the counties, and because I'm within Kakamega County, so I did my paper on Kakamega County. Let's go to the abstract. On the abstract, since the beginning of COVID-19 global health crisis, several media interventions have been put in place across the globe to help curb the spread of the disease or virus. During this period, people are using different media to access information about the disease, and community radio has featured prominently because when COVID-19 struck, actually, many people at the community level didn't know what to do, didn't know what the virus is all about. So community radio came in handy to disseminate the information. And you know, community media, most of them broadcast in the languages that the communities really understand. Community radio is a local and participatory medium of communication that provides information to the rural community in local languages. Majority of the population in Kakamega County in Kenya cannot access internet, especially in the rural parts, due to cost implication. As a result, community radio stations continue to serve as prominent media outlets, especially during the COVID-19 pandemic. You know, many people cannot access internet given that most of the people in the communities don't have even access to smartphones. And with the strain of COVID-19, people will think about having food on the table rather than buying bundles to access internet. So because most of them have access to radios, smaller radios, most of them listen to the community radios that broadcast in their languages. Kakamega County has several community radio stations that serve the communities. It's therefore critical to ascertain the role community radio stations play towards COVID-19 prevention and management in the county. The study targets community radio personnel and listeners of community radio stations. Community radio personnel will be sampled purposively, whereas listeners will be sampled using simple random sampling. Data will be collected by use of questionnaires and interviews. Qualitative data collected from the interview schedules will be analyzed thematically and presented in narrative form. Quantitative data collected from the questionnaires will be analyzed descriptively and presented in tables and graphs. So in this presentation, I didn't put the graphs and the tables, so I did only the summary part. This study aims to contribute to knowledge on the role of community radio in COVID-19 prevention and management in Kenya and beyond, not just only in Kakamega County in Kenya, but also beyond. So the questionnaires and the interview questions that I used, I've just summarized community radio personnel. I had some few questions that I used. How have you ensured that the rural population has access to information on COVID-19? How have you been packaging information on COVID-19 to ensure the audience understand? What major issues about COVID-19 did the audience want to know more? How has been the response from the audience? And then to the listeners or audience, I asked which media outlet do you use to access information on COVID-19 pandemic? How effective is the media outlet? Is the information gotten about COVID-19 efficient for your knowledge? Does the information help you make informed decisions on matters COVID-19? Those are some of the questions that I asked the presenters. Actually, I sampled, there are over 10 radio stations, the community media, but I sampled around 6 and sampled a few journalists of whom I asked those questions. So the findings were from the journalists as per the answers from the questionnaires and interviews, because I used questionnaires and interviews conducted randomly. Community radio stations played a critical role in the prevention and management of COVID-19, not just in the county, but also beyond. Most journalists working in the radio stations in these stations say that it's important to put the information in the language well understood by the audience for them to act accordingly. They also involved health experts as professionals in their radio programs who expounded more on matters COVID-19 and also gave updates from time to time on how the government is managing cases of COVID-19. Here, the journalists said most of them will call experts, health experts in the station so that they can debunk and they can expound more on the terminologies and on the issues COVID-19 so that the community people can understand or the audience can understand better. And they were using local language, the language that the community understand better. Some of the quotes I got from some of the journalists, one said, as a radio journalist working at Imani Radio, I translated most important information about COVID-19 to language well understood by the audience and also updated the audience from time to time on what the government is doing to manage COVID-19 cases. That's Sharon Ambani, a radio reporter. Now, Marvin said, I have done sensitization and carrying out programs with expertise, discussions on proper use of masks, social distancing, etc., and also use having the talk shows incorporating affected people from the community who have lost their loved ones through COVID-19. She says, adding that she also does talk shows where expertise from health discuss on matters COVID-19. That's I just explained that journalists will bring experts in the studio just to expound more on the issues of COVID-19 and maybe to debunk on the myths that are going around about the issues of COVID-19 and especially when it comes to the vaccine so that people can be able to go and get that vaccine because it's very important in terms of curbing the spread of COVID-19. Next slide. Okay, some responses from the audience. The audience that participated in the interviews and survey acknowledged the fact that most of them depend on community media, especially radio, to get information about COVID-19. They say the information is important for has helped them in making positive decisions on taking the COVID-19 vaccine and also adherence to measures to put in place to curb the spread of the virus. Some of the quotes from the audience that I interviewed, some I interviewed them through used questionnaires, some interviews via calls and on radio. Yeah. They said, one of them said, I get information about COVID-19 through Most FM radio, for I can access internet on my, I can't access rather internet on my Mulika Muzi phone, that is phone with no internet settings. This information helps me know ways of protecting myself from being infected by COVID-19. Alan, Mama Sean, the way they call her, said, I listen to radio most of the time to get updates on COVID-19. the updates on the measures to help curb the spread of the virus mostly, where I now together with my family have embraced washing hands all the time, something we never used to do. So Mama Sean says in fact, washing hands all the time was not like anyone's business, but now they are doing it all the time because from the information they got from radio, they saw the need on why they are supposed to wash hands all the time just to help them be guarded from getting COVID-19. Franco said, personally, I listen to radio mostly and sometimes use my phone whenever I have bundles to access internet and get information on COVID-19, especially the vaccines, of which as a person was reluctant to get the jab. Had our mind changed after getting the information, and together with my family now, we have gotten the vaccine, which is a positive thing. And he's just representing most of the audience who are like they don't believe in the vaccine. But after getting information from the radio in the language they really understand, they were able to go for the jab. And most of them are now okay. Dorothy says, mostly I access COVID-19 information through media, including radio, TV, online. I frequently listen to community radio, though, which broadcasts in a language I better understand. The information gotten helped me to make informed decisions and went for the vaccine. I have also embraced the measures put in place by the government to help curb the spread of COVID-19. So from this, sample period was immediately after COVID-19 struck, vaccine admission period up to now. That's when the time I did the research. And then the conclusion part, which is not on the presentation, community radio stations really, someone is not mute. Hello, someone is not muted.
Yeah, please let's all mute and
I'm just doing my conclusion part, which is not on the slide.
okay. I can't figure out where. Okay.
Maybe the host can mute the person.
So can you unmute Lilian and conclude? Lilian?
Okay, you didn't get the last part.
Yes, because you were muted. I think everyone got muted, yes.
Okay, Sawa. So my conclusion part was that is that community radio stations and media really played and still are playing an important role in COVID-19 management, be it within the county, be it globally, be it nationally. And many people have really received the vaccine as a result of information they have acquired and that has been disseminated through these media channels. Yeah, that is my presentation for today. Thank you for listening.
I appreciate that very much, Lilian. Thank you so much. And I would like to invite Gladness. I hope you've been able to join us to make your presentation. Gladness?
Hello?
Yeah, Gladness comes to us from Tanzania, but I'll not, she works for the Crisis Prevention Center, but will not go too much talk about her because she's having connection problems. So while we have her, let's listen to her. Yes, Gladness, we can hear you. Please go ahead.
Thank you. Thank you, everyone. Maybe someone has to show the host. I don't know, the host has my presentation, or you wanted me to
I can share it, but if you
okay. Let me introduce myself. As you said, I'm a journal and gender activist and majored in public health, leadership, save the mothers. Currently, I'm coordinating an organization called Crisis Resolving Center, and this is a legal aid center that was established by the Tanzania Media Women's Association. It's a milestone to Tanzania Media Women's Association, as themselves they are doing more advocacy work, and after the advocacy work, the community, specifically women, they used to come back to Tanzania Media Women's Association, that is TAMWA, to seek for legal services, counseling, and so on. So in 2007, that center was registered officially, and we are still working. So in my presentation, and I believe it will be, should I share the screen or wait for the?
Yes, if you can share, please do so. I'm having a few technical issues, so if you can share, please go ahead.
Okay, I'm trying. I tried as we are waiting for it. Much better if I can go on. Oh yeah. Um, Thank you. That is my presentation, possible solutions. Okay, the outline will be like overviews, then, okay. Can we begin with the, yeah, the first overview? Okay, yes, that's the first overview. Thank you so much. Possible solutions for the women in media. Okay, overviews where and the work that have been done. Okay, the overview, as I said, in Tanzania, uh, currently we are having a 60 years, 60, since Tanzania got the independence, and media in Tanzania is rich in community and every online. And after the independence, about 40 years, media in Tanzania started with only two media outlets, and these are a radio, a public radio, and a print, and all were public media by that time. currently, after these 60 years, we are now having more. See them, I will mention them at the. But various studies shown that women in media are the most vulnerable of various. Another slide, please. Another slide, please.
That's the next one. It's overview, continue.
Yes, vulnerable women in media have. Yes, I've seen it. I've seen it. Have been identified by the various studies. Those are that shows that women are vulnerable. Uh, so they start before, during, and after the COVID-19. I would like to media progress start that was called Gender and Media Baseline start that was done earlier in 2003, and then in 2015 we had a gender media progress start, and this start was organized by NGO, the regional NGO called Gender Links. Yes, and the same gender media progress study was also done on 2018, and it shows that 50%, it shows 53% women are represented on the media. And another study by 2019, it shows that 50%, just 1%, but the same study was done during COVID-19, that is 2020, the month of September last year. And media personnel in Tanzania, none has majored or specialized in various sectors, let alone health. In the professional, the gender media progress start on the month of on the last year, September. We were also looked at the professionalism, because we would we want to have the data that shown that how many journalists can report on health issues, pandemic. So due to that, that is a problem or an obstacle, that we don't have a group of media that specialized um, on this COVID-19, on health issues specifically. Uh, our and we know that. Okay, thank you. To realize that Tanzania media outlets missed the emergency policies as well. As I wanted to explain more on that, due to lack of professionalism, and specifically on health issues, reporters in Tanzania reported each and everything ahead of them. We had so many reporters, so many media houses, community radios, religious radios, private and public media in Tanzania, and it's almost a third country in Africa. If you mention number one, Nigeria and South Africa, then the third country is Tanzania. But we missed this important sector And not only from this start, but myself in my public health leadership, Save the Mothers, I was I wrote a thesis on sexual reproductive health reporting in Tanzania for the print and electronic media, and we missed most of the important news due to fact that our reporters, they're just reporting what is ahead of them, what they heard from somewhere, from other sources of different channels of media, and so on. So almost all media personnel were not passed through short courses, how to work in the life of the outbreak, outbreak in 2019, in 2020, sorry. So at the small interview with them, they admit that they were only participate in the short trainings in the following areas below, as peace building and conflict resolution, media itself, informers, and gender, climate change, and sustainable development. So they were just having these short courses in due course of of their their work.
And you need to speed up a
Lack
little bit
of
because
images.
Gladness, your time is running out, so
Yes,
kindly
yes,
speed up a bit.
okay. As I said earlier, in the media houses, but they lack having this of emergency care for themselves. If some affected, they were affected very well periods, and most of the media houses were also closed. They were this due to fact that working equipment were very few, and the situation not conducive for both women, for both, all include TV and newspapers missed that I said because it was done for a month and we missed the most important news. Even to explain properly how to be protected with this pandemic COVID-19. Another slide, please. Another slide, yes. We have a Media Council of Tanzania, and this Media Council of Tanzania released a formal booklet that contains information for the protection for all media outlets in Tanzania. We have this booklet, but I'm not very sure if all the media houses have been received and worked on it. That is another area to be worked on. And basically, that contingent from Media Council of Tanzania is guiding for media outlets to localize as well, because it is not mandatory, and because other media outlets, they are located at the village level. Another slide. So difficult times, as I said, media outlets lost their staff, especially the public media situated at the major city here in Dar es Salaam. They lost staff for this COVID-19. And the news were full of dangers of pandemic instead of giving people relief and encouragement like that. And we were not in the lockdown. Imagine, we were still working, we were still doing our duties on and off, but the media failed to encourage people properly. Staff were reduced in some media, and in some media were redundant. Yet media, they are not on closed. Some media outlets closed down, as I said. Sales and advertisement decreased and they failed in total. That's why even other media houses were closed. Another slide. Okay, the result, most of the media failed to maintain manpower. Media were among the champions on providing awareness to the community, but they lack proper information. They need to be trained or to get orientation on how to report it properly, because people were depending on them. And to date, sensitiveness of COVID-19 precautions are being followed. Another slide. Yes, recommendations. Media to establish trainings, like short trainings. These are recommendations or solutions that were advised to be shared by media outlets in Tanzania. Awareness on health issues, whereby they can learn on communicable diseases and non-communicable diseases as well. Media policies on health should be prioritized, as currently they have HIV and AIDS policies. And then we wanted them to have a major one on health issues, where these communicable diseases and outbreaks will be there as well. And we know that the HIV is non-communicable diseases. Second point in media policies should be prioritized. Management to increase furniture, cameras, and computers. It was a problem, a major problem, due to lack of furnitures. They used to share in those other years. So during pandemic, it was a problem. Online interviews to be used more. This is a new technology, but we need to encourage also to train them, but because not all reporters or even editors knows how to use online gadgets, like meetings like we are doing right now. And yet in another profession they were in that plan, they were using online issues even at the court, but the media, they failed to work on that, and that is the high time now to learn on how to work in that. And the sanitizers and wash hand water and soap to be available all the time, not just during the pandemic or outbreak like that. Another slide, please. I think I'm concluding. And this is my last slide. As I said, the data, they are there. That shows that Tanzania is the third country rich for media outlets, being it electronic, being it print, let alone digital media. And the data showed that we have 183 radios, 43 TVs, and print 226, and 22 blogs and TV online. So this is a very serious. Let's take this serious to make sure that our reporters are dear moderator and listeners, thank you so much for listening to this short presentation. Thank you so much.
Thank you, Gladness. We truly appreciate you sharing the view from Tanzania so we can get an all-round view from across the continent. We now have a few minutes that we want to dedicate to questions. Please remember we've had presentations from Dr. Nouha, from Dr. Atef, from Lilian, and now from Gladness. And so if you would like to ask a question, you can raise your hand. I have seen a few questions right in the chat. I'm not sure that I've seen questions for Dr. Nouha or Dr. Atef, but maybe I missed something. Because I think it's better we go in that order. If not, I had a question for both of them. In your work, looking at how that is Egypt and Tunisia, and how, oh, Comfort is here. All right, people. Sorry about that. We looked for you earlier because we were expecting you to present first, but now that you're here, I think we'll give you 10 minutes because we need time to be able to discuss. So kindly take the 10 minutes, introduce yourself, and share your presentation. Thank you very much.
Hello there, it's a pleasure to be here. Network has been a challenge for us, and I hope you are able to grapple with it where you are. From Nasarawa, Nigeria, it's been a hectic thing. We've been having issues with network. I've had to relocate, and in the relocation, this is where I can catch you. Good to see you all. Good day, everyone. My presentation, should I continue, Gladness?
Yes, please go ahead.
Okay. Yes, so you have my presentations from 2 days, yesterday. Is the slide there with you? If it is not, I could just speak to it. My presentation is on the impact of COVID-19 on the media. I have testimony of resilience. I like to say that it is in the spirit of resilience that this conference is holding today. Yes, if you look at how we were from the time of call for papers, call for abstracts, it has been a hectic thing. What about it is network challenge, and we have to keep at it. Last time we're together live was in Kenya, 2019, right? And you all ladies are looking very good. I am Dr. Comfort Ukwela. I'm from Federal University of Lafia in Nigeria, Nasarawa State. That's where network is dealing with us. Talking about the impact of COVID-19 on Nigerian media. To say the least, it was a good sign of adversity. Why did I say good and sign of adversity, like contradicting myself? No. We were faced with challenges of how to maintain the media and how the Nigerian populace in lockdown will know what to do with themselves and the society. In respect with what was happening around the globe, that was a gloomy picture for a country that did not plan for that, you know. COVID-19 came and there was no planning for it. No one knew. It took everybody unawares. Nigerian media, you know, our state, that the nature of the media has been more like analog. You have to wake up in the morning, take cameras and scout for news and scout for advertisements and all of that. And then came a sudden lockdown, and yet the media had to go. Now, how Nigerian media came out of that shock is the testimony of resilience. And in my paper, I decided that instead of doing the talk, I'll go to the media and get the people, the managers, and the reporters to share their experiences. What else do you expect of a media manager myself who knows how to do video production? That was what I did. So if time permits me, I'm going to share with you the live interviews, which was my research methodology, using interview, focus group interview, a testimonial. Now, if we talk about resilience, we know very well that the spirit of resilience is that one that says, yes, there is a problem. You can address the problem. You can look at the problem head on and know that it is a problem. And in our case, the problem of COVID-19 hit the African women more. I don't know about you in other parts, but the Nigerian media, especially the female journalists, had the hardest hit of that impact. How was it? How would you manage, for instance, to keep up with reportage with the situation around you in your own place, as a mother, for instance, and a journalist for the other, at the other end? So resilience says you should keep up. And well, the theory of resilience is there that says it is not what the adversity says to you, but how you react to it. It is that reaction that led us into what we have today. And what was it? In a short minute, it is to say, yes, there is a problem, and the problem is here. How do I keep up? And how to keep up is one. Do not wait for advertisers to come to you. Do not wait for advertisers to come to you. The media industry had to go around it quickly by developing projects that could yield money for the media to keep up, for the media to keep running. Yes, also the issue of having to leave the era of physical contact to using the technologies to do Skype, to do Zoom, and to book your interviews with your clientele online, have them interview themselves, put on YouTube, and you download and use here. That was another way the media in Nigeria ran out of the problems or the challenges of COVID-19. And then, of course, the problem of training. You and I knew that stumbling into a new thing means trial by error in several ways. And so it was for us. That sometimes the pictures are not well composed, and so it freezes. And sometimes the connectivity is not even there. Till now, we are grappling with that one. I, for one, have been grappling with the problem of connectivity in the past days, where, okay, you have to physically relocate from one location to another in order to at least speak at this event. That is a problem. And so resilience means we will need to keep working at the few methods we've been able to use to stay afloat, perfect on it, and continue in that realm, especially because COVID-19 has come to stay, and the Nigerian media must also stay aboard of it. I wouldn't know if you give me a few seconds, I'll play the video of the testimonials of the media managers. Just keep up to me a minute, just a minute, just hang in there, so that we'll see that, yes, from the people who were really in the situation, this was what they had, and this is how they coped with it. Okay, just 1 second. The video is coming. Yep. It's coming up in a minute. Okay. The spirit of resilience, fighting back. And by the mercies of God, perhaps in 2022, we shall be able to see ourselves again. We hope it will be fine by then, such that we have our warmth, because one thing COVID-19 deprived us of was that physical warmth that we had in Kenya. I'm actually looking forward to it. So it's coming up in a second. It's coming up, the slide is coming up in a second. Okay. Scroll. Yes, there we are. A testimony of resilience. Okay. Okay. Well, it's in a bit troubleshoot this. I've recorded my presentation, and I hope it's with you, Irene. Dorothy, my presentation is there. I hope it will be able to come on.
Where is it?
I sent it to Irene yesterday.
Okay.
Well, I'm trying to see if I can play it. If it doesn't, that is the testimony of resilience. If it doesn't play, then
is it on YouTube?
Can you try?
Is it on YouTube?
It's on YouTube, no. Google Drive, right?
Okay. Maybe you can send me the link and you can try.
Yeah, we had, okay. Perhaps I'll send it to you again.
d1gco.n. Let me type I'll send you my email.
Okay, well, that's okay. Well, the media men and women, I'll send the video as it were, but it is to say the challenge came and we're able to stand afloat by the diversity of approaches we used, and we should only concentrate on that and perfect on it. Thank you for being there. Thank you for listening.
Thank you so much, Dr. Comfort. We're happy that you were able to make it. Thank you for the efforts you made.
Thank you, Dorothy. Thank you.
So thank you, everyone. We now transition to the Q&A section. And I would like to invite you to, like I said, you can put up your hand and go to reactions, and there's a hand icon there. If not, we will look at some of the questions that are in the chat, and we have one for Lilian. Lilian, are you still with us?
Yes, I'm here.
Wonderful. So you've seen there's a question for you in the chat. How can community radios, media, bridge into digitalization? So how can you be a bridge into bringing people into the digital era as a community radio? So maybe you can answer that, and there's a second question, so address both. There's one on methodology used for the clear. Please clarify.
Sure. I've seen the I've seen the questions, and I tried to answer on using the chat, but I'll still just answer. Because Brenda says, how can community radio media bridge into digitalization, that is internet? I assess that to bridge the digital divide existent, there is need for empowering community media with media viability. And I've just told her that, yes, it's true. And there's an ongoing process in terms of community media undertaking media viability trainings so that they can be able to do that. That's the best way to go. Presently, like in our station, we are having those trainings and for a period of like 4 months now, and I'm sure we'll be able to internalize that. Then we have Koja Emu says, thank you, Lilian, for your presentation. The methodology used for the study is not clear. Can you please clarify if this is a quantitative or qualitative study or a combination? It would have been helpful to see the study's objectives. And I just tried to answer her. I said, thanks for the questions. Data was collected by use of questionnaires and interviews mostly. Qualitative data collected from the interview schedules was analyzed thematically and presented in narrative form. Quantitative data collected from the questionnaires was analyzed descriptively and presented in tables and graphs. And I put in quotes, the tables and graphs are not in my presentation. As I said earlier, before presenting, I said that I've just done a summary of my presentation. I didn't put my whole presentation. And the objective mainly was to contribute to the knowledge on the role of community radio in COVID-19 prevention and management in Kenya and beyond. Yeah, I think those are the answers I gave. Yeah.
Okay, thank you very much. Really appreciate. As we wait for more questions, I had a question for you, Dr. Nouha, and maybe Dr. Atef, you can, I think the question applies across to both of you. You have very interesting findings about how the journalists in your countries were impacted by COVID. I just wanted to find out if you are able to disaggregate the data and compare the impact between men and women journalists, given that we are at a gender conference and we're interested in the findings as far as gender is concerned. So kindly, if you can speak to that, thank you. Any of you can start?
According to Tunisia, there is no difference between women and men. So that's why we didn't ask the questions. Women are more involved in the field of journalism in Tunisia, even in the university, in the School of Journalism. So the number of women are more important than men in the university, in the School of Journalism. Then in the media, there is no difference between men and women. That's why we didn't ask the question.
Hello? Hello?
Hello?
Yes. In Tanzania, as on the gender and media progress study that was done in 2020, it shows that, and the results here, I will provide the results at the regional level. That is SADC, Southern Sahara. It shows that results, like women make up 21%, and this is a representation of women in the media during that COVID-19 pandemic. And this also represents media women reporters. As a doctor from Nigeria said that women reporters were most affected people. The same here in Tanzania. Reporters were the most affected due to their roles of working family, and they at the same time they are required to continue or proceed with their normal work in their media outlet. So they were mostly vulnerable persons. As we know, in some areas they were locked down, although Tanzania it is not there, but the schools were closed, other jobs were closed. So, at the family level, a family can be at home for more than, let's say, 10 people, 8 people. We know we Africans, the way, the lifestyle that we have. So as a media person, being it a woman, they were affected. As I said, it's made of the voices heard, print, television, and radio, just 21%. And the rest of the percentage covered by men. Thank you.
Thank you very much. I had a follow-up question for you, Dr. Nouha. You had indicated in your data that 83%, 84% roughly used phone calls in their work. Those are the changes brought about by COVID. And then you also talked about 50% communicated directly. So I was just wondering what the difference between that was. You also talked about 45% or so using Facebook and 53.3% using the internet. So I just wanted to know how you distinguished between use of Facebook and internet. What were the distinguishing lines between the two data sets? Thank you.
Thank you again for your question. When I say that some journalists lost their jobs, that's meaning they didn't work and stopping working because their companies are not able to pay their salaries. But working remote work and using Facebook, there is a difference. Working by internet, using internet, that's meaning they use email, they exchange information by email, by some applications, and using Facebook, that's meaning they check information via Facebook. You know, during the COVID-19 crisis, journalists haven't been able to go. Um, to check information only from the official sources, which is the Ministry of Health, of Public Health here in Tunisia. So Facebook presented a source of information. That's why Tunisian journalists tried to make contact with citizens via Facebook to get information in their cities. Because we have only one source of information, but when you have a crisis, we can use Facebook as a source of information, of course, with fact check.
Thank you very much. And the other Dr. Nouha, Dr. Atef, wanted to find out, you talked about some innovations people came up with in the face of COVID in order to continue doing their work. Maybe if you can expand on that point.
Which point again?
About the innovations or improvisations that people used in the face of COVID to continue with their work.
Well, they didn't innovate, but like their self-development became a need. So they were pushed to learn new skills, new digital skills. Also, mainly about like using the digital communication, reconsidering their relationship with their profession and setting their priorities, like should I go out and break the quarantine or get out of the quarantine to do my job, or should I prioritize my personal safety and stay at home and do my work from my desk at home, even if it's not it's not gonna be as perfect as in the field. Also being in the field, what relationship do I have with people? Like as a journalist, do I consider myself like more knowledgeable than them, or what's my message? Is it just broadcasting their conditions, or do I need to intervene by raising their awareness? So it's more about the self-development, and I think they were pushed to do this. Yeah, and if the pandemic didn't happen, journalists will not reconsider this or go and learn. I mean, like everybody now using Zoom. This wasn't the case before COVID. Everybody needed to set up a place for working at home, so a home office for themselves, and they get accustomed to work in different conditions, like work at night, at evening. So they gave up their work, their daily work routine. I think this was the case. Regarding innovation, I didn't observe any innovation, but maybe if we investigated this extensively, we will find people who came up with creative solutions, especially in the areas with trouble, like in conflict areas or places, neighborhoods which lack like infrastructure and so on. They should have came up with innovative solution for this.
Thank you so much. And maybe my last question would be to Gladness. You mentioned that you guys did not have a lockdown, nothing. I mean, of course, we know that President Magufuli announced there was no COVID, so life was normal there. So how did that impact the work of journalists in Tanzania, if you can share that briefly. The reporting of COVID, how did that impact the reporting of COVID? Where the government official position is there's no COVID, yet as a journalist, you have this responsibility to report on such issues and health issues. Gladness.
Yeah, thank you so much. Let me clarify a little bit better. In fact, our late President Magufuli, he's not said that there's no COVID. COVID is there. And he said that the COVID is there as a pandemic. But what he insists for the people not to fear, not fear about that, because it's just a pandemic like other pandemic. And he straight away said that we need to follow all the precautions. But what he said that he cannot keep people stay due to our styles. It was so bad. So what the health specialists, they said that if you manage to work at home, work at home. If you don't have something special that may make you to go out of your house, please stay so that you can be more safe. And even wearing of masks, our president preferred to use the that you can make it on your own, but make it properly. Preserve very well to avoid those virus, rather than depending on masks from outside of the country, because we have seen several information in the social media about the bad thing from outside of Tanzania, but also masks that have been sold in the street. They were not very much approved to be safe due to several scenarios that have been shared, that masks have been something like that. So he was straight on the use homemade masks or local masks and take care of ourselves. That the condition was not good in the other countries, because by that statement, most people say that a woman who is doing who is selling foods, cooking foods, this fast, they failed, most of them, because of the people they were at home, eating at home. So consumers decreased. And yet that woman has a loan from a loan center or from the bank, and she is required to repay that loan. So that is where mental health issues came out. So we experienced a lot of health problems among the family members, and the source was dropped of the economically due. That's why at the center, like the one crisis response center, we received so many cases that we were required cases to the community, to the schools. We do outreach, and we are still doing currently.
Okay, thank you so much, Gladness. Thank you so much, Gladness. Our time is up. I will allow, yeah, thank you so much. So we'll have Comfort give a final word and we will close this session. Thank you.
Thank you very much, Dorothy. You know, I had said in the chat that women are affected more with the impact of COVID-19. Why? As a mother, a wife, a worker, you also consider the fact that if you, a woman, decides that, okay, you want to risk your job, risk your life, go out there, do reportage, you have your family to consider. You have the voice. In my papers, it's a pity you're not seeing my presentation yet, but in the paper you will see that I said the superego, which is supposed to be the rationale to slow you down, to balance things, will tell you, you go, won't you slow down? You have your life to live, you have to live for your children, you have to live for your family. But you see, like my friend in Tanzania said, the woman has the spirit of resilience normally, and it is the African woman that will say, no matter what, let me go brace it. My parting word here is, COVID-19 came, did not warn us. We've all survived. Let us work more on the things that helped us to survive and stay afloat the more. Thank you.
Well said. Thank you very much. And thank you everyone for attending this session. We appreciate your presence and your involvement. Do have a wonderful day and hope to see you in the other sessions. Goodbye.
Thank you, Dorothy. Thank you very much.
Bye. Thanks all. Thank you all.
Thank you. Thank you.
Thank you.
Thank you. Thank you.
Thank you for the good session.
Thank you so much. Bye-bye.
And we learned from others.
Yes. Thank you.
Yes. Thank you so much. Bye.
Bye.
Bye.